Dr. Nguyen, I would like to talk to you about dentures. Apparently there's about, 40, 45 million people in the country wearing dentures. And most of them complain that their dentures start getting loose. They think that the denture loses its function, but that's really not true. It's the mouth, the gums, which are shrinking apparently. But that's beside the point. A loose denture is very uncomfortable. And there's this new thing out there. It's not new, but it's relatively new, and that's called an implant-supported denture. I call it a hybrid, where you have a denture, but you use implants, not a lot, a couple of them, 3, maybe 4, maybe, it all depends. And all of a sudden, apparently, that denture is wonderful. That denture is absolutely like day and night. Shed some light on it. Is that true?
It's absolutely true, and I'm happy to tell you about that. Because personal experience, I have several patients with dentures and, partials and things like that. And after the years, the teeth start deteriorating, and now you need to pull them out and then make new set of dentures. Or the one that already have dentures, years without having teeth, the gum and the bone just resorb away, so it's wasting away, and now the denture don't fit anymore. And absolutely, if you just put a few implants in there, the dentures sit on the implants and it just like rock. And one of the patients told me that he can now enjoy, the ribs, the steaks, and all of the things that he haven't been able to for years. So it's a great service. So, absolutely great.
So what you're saying is that if you have an implant-supported denture, you can chew on a spare rib and you can bite into an apple, something you probably can simply not do with a normal denture.
Exactly.
Wow. Absolutely. So, and yet, this type of, putting a denture in it with 2, 3, whatever it may be, implant, must of course be a lot cheaper than doing many implants, the whole mouth. I assume that most people, not all maybe, but most people who choose a denture simply choose it because of price. Am I correct there a little bit?
Yeah, that's to some extent, but seriously, a lot of people do want to have something fixed, but unfortunately, sometimes they do not have enough teeth to do an anchor, like what we will call like a bridge, and then you just end up with less options, and maybe denture or partial would be the only choice. And now having the implant, just like you said, just a few, like 1 or 2 in there, and that could help, retain the denture or the partial a whole lot better, and it acts just like your natural teeth. And so that is like really, really neat.
And it's a lot cheaper, right? Because 1 or 2 implants couldn't be as much as 5, 6 or 10 or 15 implants, right?
Right, versus like you do a whole mouth of implants.
Right. And as you mentioned, because a normal denture covers the palate, so you really can't taste the food very well. And what you're saying is with this denture or the implant-supported denture, you can't taste the food again?
It's very likely, because it helps. You don't really have to have a lot of denture, like you said. We can certainly just manage it like in the teeth area only. We don't have to extend it to anywhere else. And obviously, you have the palate free, and then you can definitely enjoy a lot more food, and taste better, smell better.
Right. And you don't have to worry when you're at the Christmas dinner, like now Christmas coming up, that when you laugh, smile like you just did, that you worry that they come out. They might never come out, but people with dentures seem to be worried about it. They might not come out, but they're worried. And that's kind of, all that is gone.
Yes, that builds a lot of confidence, and exactly what my patient was telling me too. They said now that they're confident, they have the smile, they have the teeth, they know that it's not going to just like blow on them, like falling out or anything like that.
Beautiful.
So that's really great. Yeah.
And no more denture cream or adhesives, no more gluey stuff in the mouth either.
Absolutely not. That's the beauty of that too.
Well, all right. Here you have it. It's good to see that dentistry didn't get bypassed by technology. It's included. Dentistry is improving too. Absolutely great. Thank you very much, Dr. Nguyen.